You are watching Redicon. Viruses are known for respiratory tract infections. These can be upper respiratory tract infections such as common cold, pharyngitis, epiglottitis, laryngotracheitis, and the associated changes such as sinusitis or otitis, or the viral illnesses can be lower respiratory tract illnesses such as bronchitis, bronchiolitis, and pneumonias. Common cold, normally caused by rhinoviruses, which are also ribovirus or RNA virus family. These have more than 100 serotypes and are most common pathogens. At least 25% of colds in adults are caused by rhinoviruses. Coronaviruses may be responsible for more than 10% of cases. Other pathogens include parainfluenza viruses, RSV or respiratory syncytial virus, adenoviruses, and influenza. Pharyngitis or sore throat is mainly viral and accompanies common cold or influenza. However, type A Coxsackie virus, adenovirus, herpes simplex, and sometimes Epstein-Barr virus and cytomegalovirus can also cause the same. Upper respiratory tract infections are usually benign, transitory, and self-limited, although epiglottitis and laryngotracheitis or croup can be serious disease in children and young infants. Epiglottitis is mainly viral in origin and mostly caused by H. influenza type B. This is photo of an adult 48 years old man presented in an urgent care clinic with adenophagia and fever. A radiograph of neck showed thumb sign and a diagnosis of epiglottitis was made, as highlighted with an arrow on the lateral neck radiograph. A direct visualization showed marked inflammation of the epiglottis and in the surrounding. A repeat laryngoscopy 2 weeks after the initial presentation showed complete resolution of the infection as seen on the left side of the screen. Interestingly, however, the culture results in this one showed it to be a bacterial infection. Parainfluenza viruses are the most common pathogen in laryngotracheitis or croup. Steeple sign is a radiological sign found on a neck radiograph where infection and mucosal edema in subglottic trachea results in luminal narrowing, and it appears like a church steeple. The above radiograph shows a steeple sign of croup or laryngotracheitis and is a clinical emergency. Bronchitis is a lower respiratory tract infection and is usually preceded by an upper respiratory tract infection or forms part of a clinical syndrome in diseases such as influenza, rubella, pertussis, scarlet fever, and typhoid. Bronchiolitis is a viral respiratory disease of infants and primarily affects smaller airways, common viruses being parainfluenza, influenza, adenoviruses, and RSV or respiratory syncytial virus. In lower respiratory tract illnesses, in addition to bronchitis and bronchiolitis, viral pneumonias can happen. These are rare in healthy civilian individuals. However, influenza viruses can be an exception with high mortality in elderly with comorbidities. Secondary bacterial pneumonia, particularly staphylococcal pneumonias, can happen. RSV or respiratory syncytial virus can cause severe pneumonia among infants and institutionalized adults. Adenoviruses may also cause pneumonias, where serotype A adenoviruses have been associated with severe fatal pneumonia in infants. Varicella zoster virus pneumonitis is rare in children, but it is not uncommon in individuals over 19 years old, and mortality can be as high as 10% to 30%. And measles pneumonias can occur in adults.
You can subscribe to our YouTube channel and click on the notification bell for new courses. For more modules and radiology CMAs, please visit www.radicon.org.